Okay, this is Elliot Fishman. Hopefully, I am live. And this is the monthly quiz. And this is our last quiz for the calendar year of 2025. We'll be back to you in 2026. So I have a dozen great cases. So let's look at the cases. Patient with FUO. Well, one of the things you notice is there's a cystic lesion in the liver and something in the region of the adrenal gland, or is that the kidney? Is it something cystic, which could be an abscess or mass in the kidney or in the adrenal? On the coronal view, you can see it's more extensive, and you can see it's really in the adrenal bed, pushing on the kidney, and you can see that a little bit better here. It's very unusual, right? Could this be a tumor involving the liver and the adrenal? There are some nodes in the mediastinum. This patient was febrile. I can't think about more than one or two cases of adrenal abscesses that I've seen, but believe it or not, this was an adrenal abscess with involvement of the liver. Just an amazing case. And this was published actually or accepted for publication. And it's in emergency radiology. What an amazing case. An adrenal abscess seeding the liver. Again, malignancy would have been a great consideration. Weight loss, multiple liver lesions. This could be metastasis, theoretically abscesses. Then you see a mass involving the region of the junction of the fourth portion of the duodenum and jejunum. It's a large mass, right? And then when you look at it a little bit more, it's a big tumor. It's not obstructing. Could this be a nodal mass? Could we be dealing with lymphoma? That's a possibility. Here it is on the coronal view. So the question is liver and small bowel, but not obstructed. Lymphoma is a possibility, good possibility. Could be adenocarcinoma. Could be a GIST tumor, that's a possibility. Could be metastasis. And I don't see anything else, but there are liver mets. And this was a GIST tumor at the junction of duodenum and jejunum with liver metastasis, a really nice case. Patient with chest pain, there's a mass in the AP window, it's very vascular. You can have metastatic renal cell carcinoma to nodes, that can be vascular. You can have vascular anterior mediastinal masses, but the classic middle mediastinum masses, that's kind of unusual. What is it that you could be thinking about? Here's a few more images showing that large mass. Nothing in the hilar regions, and again, you see the mass present here. Could it be metastatic disease or a primary tumor? Well, vascular masses in that location, one possibility would be a paraganglioma, which this was. Paragangliomas typically we see in the abdomen. They're extraadrenal pheochromocytomas, but just a wonderful, wonderful case. Another patient, abdominal pain. There's a left adrenal mass. It's over 4 cm, so you would go through a differential of primary malignancy, but you need IV contrast. It does enhance. The contralateral right adrenal looks normal right there. So what is this? Could be a pheochromocytoma, though not as vascular as most pheos. Could be a necrotic adenoma, but I could not tell that. Could be an adrenal cortical carcinoma. Could be metastasis. This patient was worked up. There were no lab values to suggest pheochromocytoma. The patient had no primary malignancy. This was eventually resected and was a primary adrenal cortical carcinoma. Again, larger, you got to think about ACC, but we know that less than 1/3 of masses in the adrenal over 4 centimeters are actually ACC. Incidental finding, cystic lesion head of the pancreas, that's somewhat vascular. So what could you be thinking about? You always could think about neuroendocrine tumors. Again, is this from the pancreas? Is it near the pancreas? Is it from duodenum? We then can bring up things like carcinoid or GIST tumors. I think it is in the pancreatic head, and you can see it well there where the GDA is. So you have to go very strongly with a neuroendocrine tumor. Neuroendocrine tumors are vascular, often incidental findings. Here it is on the cinematic, which shows the cystic components a bit better, but still neuroendocrine tumors can be cystic. Well, this was a solid and partially cystic serous adenoma. Remember how we talk about, and we're writing an article about serous adenomas, that they can be very vascular, and they can simulate neuroendocrine tumors, and it can be a very, very difficult diagnosis. And here's just one of those examples. Okay, chest pain. There's a mass in the patient's left atrium against the septum to the right atrium. Could be a thrombus, but thrombus usually is more posterior. When something's at that position, you got to be thinking about an atrial myxoma. You can see it here very nicely on the black blood cinematic rendered views. A really nice example of a left atrial myxoma. Chest pain, large anterior mediastinal mass, and I'm going to show you a few anterior mediastinal masses. It's solid. Thymoma is a possibility. Teratoma is a possibility. Lymphoma, and even substernal thyroid. There's no evidence of aneurysm or dissection. The mass is solid, and this was a thymoma. This case, also a mass. It's more eccentric. It has like a fluid level. Maybe it bled. It looks more cystic than the prior case. Teratomas are cystic. Thymomas can be cystic. It's uncommon, but they can be. Old hematomas, if the patient had trauma perhaps, but there was no history of that. There's a thyroid goiter present on the left. What was this? It was a teratoma. Teratomas are the classic for calcification, for cystic changes, and for these fluid levels. A very nice case. Incidental finding, calcified lesion of the right adrenal. Looks like there's fat around the lesion. I would have guessed this was a myelolipoma that previously bled. This patient eventually had this resected, and it was read by path as a hematoma. They didn't mention myelolipoma, but I still believe it's a myelolipoma that previously bled and calcified. Just a really nice example, but again, that rim-like calcification. Another example, large mass, could be kidney, could be adrenal, could be spleen, could be retroperitoneum. You can see it here, it looks like a globe, but it's a cystic lesion with dense calcification, suprarenal space, so it's an adrenal lesion. What gives you dense calcification? Every once in a while, cysts can have dense calcification, but to me, when I see dense calcification like this, I'm going with hematoma. And I went with hematoma, but this was a cyst. Because it was 12 centimeters and the patient had some symptoms, it was removed. Just a really, really nice case. Acute abdomen, and this was, I think, the last case. Look at the wall thickening, but look at the mucosa. It looks like someone drew the mucosa with a pencil. It's so sharply defined. There's a stent in the right renal pelvis. There's some stranding with ascites in the abdomen seen. And this process involves the entire stomach. It could be tumor, but tumor never has that really nice enhancement like that. To me, that means inflammatory, infectious, not ischemia. And this was gastritis, but due to candidiasis. Just very unusual and immunosuppressed patient. This I call a case of one, which means I've seen this, I recognize this in this case, and I've never made that diagnosis another time. So with that, that's the end of the dozen cases. I hope you enjoyed them. I hope you learned something. And I'd like to take this opportunity on behalf of all of us to wish you and your family and all your loved ones a happy and healthy New Year and holiday season. And with that, have a great day.